Okay, hey everybody. Um, so a while ago, I did a video. I told you that I had something big coming down the pipe, and well, here we are. The cat's out of the bag at this point for some reasons, which I'll explain. But I'm gonna bring everybody up to speed, and then I'm gonna bring everybody with me. Okay. So as you can tell, I am definitely in a hospital setting. Yes, I am in a hospital setting. In my hospital bed, right there, and then all that shit on the walls, and just I am in the hospital gown, got the needle in my chest there. I am definitely, most definitely, in a hospital setting. I'm actually getting medication as we speak. Here's my stripper pole with all my pumps and hanging stuff, and I call it my stripper pole. It follows me around everywhere. Uh, yeah, so basically the cat's out bag, and that I'm not home, and something, and I know a lot of folks heard rumors of something bad that happened to me, which 100% happened. 100% something really bad happened. Uh, and I hope everybody can hear me. I got these pod thingies in, and I just hope that with the hat over it, everybody can hear me fine. So this is how this went down. So I was accepted and came down to M&D Anderson Hospital Cancer Research Center in Houston, Texas. That's where I'm at right now. I am in Houston, Texas. I got accepted a while back. Actually, since January, I have been working the logistics, which have been a nightmare. And that's a whole nother story on itself, which we're not going to get into. But I was basically accepted for a experimental cancer drug research trial, which are not easy to get into. Um, and I made it. And through a whole bag of cats, and a whole bag of cats with the federal government, because that's obviously, the army and stuff, basically pays for everything because, they gave me cancer, hello. The DOD, I should say, as well, Department of Defense. Um, After doing logistics with them to get me to an experimental drug trial and all that jazz, because like I have an apartment down here, like there's things like that go down. Um, I made it down here, so I made it down here for like a week, and things started to go terribly wrong. Excuse me. So I made it down here for a week, and I started getting like really sick. Now, I was down here to do all the pre-testing stuff. So there was a lot of tests that had to be done prior. And I mean, when I got down here, every day, all day for a week was nothing but tests. Test, test, test. I gotta take a drink, so excuse me. Mm, that's better. So I did that week of tests. It was all last week. And um, just checking boxes, getting ready for, the to accept the experimental drugs. And what they're doing is they're learning off of me. So I am down here at M&D Anderson Cancer Research Campus in Texas. And it is at the forefront of technology. This is the only shot that I got. This is it. Um, And when I found them, they found me and kind of reached out to me as well, because they want to experiment on me, because there's not people that are alive that are like me. And that's just a long story short. We'll get into that at another episode of Facebook Live. But for right now, I'm just telling you what had happened and what is going to happen. And then we're going to get into other videos for the details, okay? But we'll set that aside for another time. So they wanted me here. I have 20 lines of therapy, which is ungodly. I've been doing this for 12 years straight. I've been fighting this disease. No breaks. It's been nuts. And there's not a lot of folks alive that are like me, especially in the shape that I'm in. I should say that I was in. It's so I was like a real diamond in the rough for these guys, and I mean they wanted me down here bad. I mean real bad. And I wanted to be down here too. So what they're trying to learn in a nutshell, and there goes one of the drugs is going off. One of the drugs is almost done. Antibiotics. Yeah, beeping at me. Anyways, what they claim is that there is no doubt that this drug combination is going to, it's actually an infusion. It's not really a drug combination. It's not only going to put me in remission, they want to see how long it lasts on a person like me that has 20 lines of therapy, just a resilient strain of this cancer that's just it wants to kill me. I mean, 12 years fighting, state of the art drugs and shit, and it never has gone away or retrieved the mission. I have a very, very tough cancer, just like I'm tough. So they want to see how long, this infusion and this process will actually last. That is the research they're getting. They're also getting a whole ton of research on other things to save lives. So this drug and the drug and the process and the infusion is 100% at the front of technology, experimental, and they're experimenting on me and collecting the data, and it's going to be used to save hopefully more people's lives, because the data that they're getting off of me is that they can't replace it, and they'll be the first people to tell you that. It's a once in a lifetime opportunity for them and me as well for their study. I mean, millions of dollars go in this study. So basically what this does in a nutshell, and this is going to be again another episode of where I explain the science behind this, because it is going to blow your mind. Absolutely. Heads up and down. The science on this is crazy. But basically what they do is they take umbilical cord blood cells, they genetically modify them and mutate them and weaponize them to target a certain receptor on my cancer cell, my specific cancer cell, and then they infuse it into your body. So, like, I'm going to have to go through some chemos and to knock my immune system down so that they can give me the infusion then, which will replicate and then go through my body and fight the cancer nonstop for the rest of my life, because it just replicates. And there's a couple infusions, and there's a way that they do it, and that's what I'm here for. That's in a nutshell. Like I said, we're going to set that bag of cats over there. We'll talk about that at another live episode, okay? What had happened to me was when I got down here for a week, I ended up getting the pneumonia, which went septic, I think. And my mom and them correct me because it's been a whirlwind for me, especially. But it got so bad that I was on a ventilator. Yeah, yes, I was actually on a ventilator about 2 days ago. They pulled the tube out of my mouth. Now, what I did not know is that statistically speaking, people that go on ventilators don't come off. They're on them forever, and then I don't know what happens, and you die. I don't know. I don't get it. But I was the closest to death that you could basically be. That's how sick from the infection and the pneumonia. And we found out the whole right side of my lungs are full of cancer, basically. It is full of cancer, I should say. So my cancer went in and took over the whole right side lung lobe. And then the infusion, or not the infusion, the pneumonia that went septic took over the left side, and my lungs quit working just like that. My lungs were like, I'm done. And this is the short version. So I was put on a ventilator immediately. And miraculously, again, Shawn Crumb, luck, being blessed, all your prayers, put it all together in a nutshell, wrap it up into Shawn Crumb, pat me on the ass and throw me out the door. Miraculously, I pulled out of it, got off the ventilator, and I'm here talking to you 2 days later, which is absolutely unheard of. Go figure. Not only that, you can see I'm not on oxygen, which is absolutely unheard of, which we'll go into that in a few days later. I recovered amazingly. I'm continuing. I'm pretty damn well beat up and skinny and depleted, as you can tell and you can see. Don't get me wrong. I didn't come out smelling like a rose in any way. I am badly hurt. I am badly broken. And I am recovering. That still did not disqualify me for the clinical trial. So not only did I just get off a ventilator, I start chemotherapy tomorrow. So I just got off a ventilator. I start chemotherapy tomorrow to set me up for more chemotherapy next week to start the trial. I don't like to brag because I feel like bragging is provoking the inevitable, and I don't feel that bragging is something that a champion does because you got to stay humble. A warrior doesn't brag, a warrior stays humble, and that's what I strive to be every day. But damn, I was on a ventilator. A couple of days later, I'm going to do chemo. That's like a level of badassery that I don't achieve. Now, listen, that was one hell of a ride. Don't get me wrong, the whole ventilator thing, but I don't recommend it, and I don't want to do it again. Okay, it hurt. It was terrible. It was nuts, absolutely nuts, and we'll talk about it. But I know a lot of folks on here were hearing rumors of things that happened, and yeah, it did. Things happened. It was pretty bad. So I'm just answering the rumors right now. Like I said, we're going to get into the specifics of things here or there. If you want to hear something specifically, write in the comments and I'll cover it. I promise you, I'll make a video just for you. I'll cover it. And we'll go over exactly what happened and how I got myself out of it somehow. So, yeah, that's what I'm doing right now. Is I'm preparing to do chemotherapy first thing tomorrow morning to try to get a response to knock down some of the disease that is in my lung. And that's just to buy me time to get to the drug trial. Yeah. A lot of people call me a freak of nature, and I am. But this one, folks, really hurt. I mean, they put me down hard. Obviously, I was on a ventilator. Holy cow. You know, holy cow. I was on a ventilator for 2, 3 days, something like that. And my lungs started working again. They just needed the rest. So I was basically like in like a chemically induced coma on a ventilator with a machine breathing for me. So my lungs didn't have to until they were okay, I guess, or strong enough to do it on their own again. And then they just took off. So I'm in the process of healing, which is hard for me to even talk. That's why I'm going to keep it short, because I do have to go get some oxygen because, I mean, obviously I'm having trouble breathing and I still have cancer and pneumonia in my lungs, and you know, I need help. I need pure oxygen to help keep my sats and stuff up. But yeah, so that happened. I'm doing okay. I am recovering and healing and fighting cancer aggressively at the same time. And tomorrow I start let me see, I'm gonna read you. I get 5 chemo drugs at one time. I'm not making this up. I'm actually gonna show you the paper here on my desk in the hospital room. I'm gonna show you the paper. I don't know, my phone just did something. I don't know what the hell that meant. It might have kicked me off live, I don't know. I have no idea, but what is, oh, it won't do it. It won't flip. It won't flip. Anyways, I'm taking, I'll turn the camera here. Ooh, maybe you can see that part here that is in print, like that I circled on the paper. You probably saw like my beautiful knee. Well, those are all the drugs that they're about to put me on tomorrow. That's how aggressive. There are 5 chemo drugs I'm taking at once tomorrow morning. Yeah, so it's aggressively fighting cancer. So that's kind of what I'm doing. Your thoughts and prayers, guys, that pulled me through. All right, I'm not even gonna lie to you. I gave God the biggest chance of taking me, and He said I wasn't done doing whatever it is He wanted me to do down here. So He kicked me back down to earth. So I ain't even kidding. That was pretty serious, and I'm just really happy to be here. To even talk to you is a miracle on its own. And I'm growing my PA mountain beard because these folks down here in Texas, man, they just, you know, I'm a mountain man from up north, Pittsburgh, Pennsylvania, baby, up in the mountains, Appalachia, like I represent. So that's what I'm doing. And I figured a beard is about the best way of doing it, other than my performance in medical field. So yeah, if anybody has any questions, leave them down in the comment, and I'll answer them. I promise you, I'll answer whatever it is you want to know. I am taking you with me. I told you I had something big. The last video, I said I had something big coming down the pipe. Maybe, you know, it was in the, you know, there was a lot of logistics. There's a lot of things that could have disqualified me from not being able to join this. They're not easy to get into because they're looking for specific things. And, you know, if you don't do one thing that they like say, for example, you have like diabetes too, they won't take you. So it is nuts. But leave it in the comments and I'll answer them. Okay? And my nurse just came in. How are we looking? I'm looking for something to give you antibiotics. Oh, okay. Anyways, comment in section. I'm doing all right. I'll talk to you all later. I love you. Bye bye.